I am Dr. Shital Maru. I am a senior lecturer at the University of Nairobi School of Pharmacy. And I would like to introduce Brian Taliesin, who is the Global Director, Living Labs Path. And Brian is the director, a very human-centered design initiative and pathwide data for action practices as part of the center was created by him. Prior to this role, Brian led digital health implementation services focused on development of scalable, sustainable health information and supply chain solutions. Brian, you have shaped PATH's approach to business systems analysis and served as a catalyst for early versions of open LMIS systems and associated adaptation for immunization information systems. He's a strong advocate for interoperability, and global standards, including GS1 and integrating systems with the support of Open HIE. Brian holds an MSc in health informatics and has over 30 years of experience in design software and application development, implementation of projects with WHO, UNICEF, Gavi, and other non-government organizations and multinational firms. So welcome, Brian, to this discussion. Brian.
Thank you very much, and it's such a pleasure to be with you all and with the other members of the panel. I'm very excited for the follow-on conversations with you, and in general, PATH has been around for over 4 decades now in global health, and we started off with a sort of a crazy idea associated with how can innovations speed the advancement of health equity for all. And within Kenya, we've been here for approaching 3 decades as well, and doing a lot of work on health, on HIV care and treatment, malaria, as well as immunization work and early childhood development. And largely our point of view, at least for the Living Labs and what has brought me to be living in Nairobi, is how do we tighten that cycle of innovation and have the individuals at the forefront of providing us their context and their settings to be able to improve the overall advancement of health, both for the beneficiaries as well as for the healthcare providers. And especially as we start to advance and the COVID global pandemic has sort of brought into light a lot of the challenges that we have with the existing supply chain system. Things have often been shut down as far as our ability to provide that global flow, have been needing to be able to source information and expertise locally. And then now as we seek to immunize 1 billion+ individuals on the planet within a short period of time, how do we sort of provide that level of supply chain logistics and cold chain capabilities to all the places that need it? And so from PATH, we are looking to be there at and supporting the ministries of health in the places where we work, and from that, looking forward to the insights from the panel on the various challenges that they've seen in the era of COVID and how we're being able to address these together.
Good. Brian, tell me which countries in Africa are you working more than 50% to receive these COVID-19 vaccines?
Really good question, and I'll run through all the ones that I have on my list right now. So we have a strong presence in multiple countries in Africa. Kenya is one of the sort of our larger office areas. In East Africa, we are also have offices in Ethiopia, Uganda, Tanzania, and Malawi, and then West Africa in Senegal and Ghana, and then also the DR Congo. And we also have individuals that are providing project-based support in South Africa and in other countries such as Rwanda. Especially on the malaria front, we've been doing a lot of supply chains and logistics in a lot of additional countries, and have been seeing about how we'd be able to adapt those capabilities and those systems and that infrastructure to be able to support the COVID work as well.
That's great work, Brian, with Beth. Let me introduce the second panelist on our group is Ms. Samiratu Adrugao, who is a researcher and an advocate in population and global health for Women in Global Health Francophone Initiative. And she is also in charge of the CIHR INSPQ McGill University. So welcome, Simaratu. You are actually a consultant and advocate in population and global health. And you look after certain diseases, specifically infectious diseases, cancer, adolescent and youth health, inclusive of maternal and child health. So Simaratu, I think I will not go through, I wish you could introduce yourself and tell us more on what you do in West Africa.
Thank you, Sheetal. Thank you very much. I'm a CIHR Health System Impact Fellow for McGill University and the INSPQ in Quebec, and I'm an advocate for women in global health. I'm leading the initiative in Francophone West Africa. So what is Women in Global Health really? Women in Global Health is a movement and organization that brings together all gender and backgrounds to achieve gender equality in global health leadership. And we really believe that everyone has the right to attain equal level of participation in leadership and decision-making, regardless of gender. And Women in Global Health provides a platform for discussion and collaborative space for leadership. It facilitates specific education and training, and we garner support and commitment from the global community and demand change for gender transformative leadership. So we are a catalytic force and a strategic disruptor. And currently we intend to establish country chapter. We have launched or pre-launched 15 chapters. 6 chapters are currently incubating, and we have 15 chapters in the pipeline. So just briefly, why are we doing this? If you look at the data, for example, the UNFPA statistic shows that 2 million more cases of female genital mutilation arise worldwide. 7 million more unintended pregnancies have been reported. 15,000 maternal deaths, 31 million cases of gender-based violence, and with a 25% increase during the COVID-19. So we globally 100 million people are entering into extreme poverty, and data shows that only 53 countries are reporting sex disaggregated data on COVID-19 out of 193 countries we have analyzed in a recent study. So we think that adopting a gender transformative policy and addressing gender inequality in global health and investing in decent work for female health workforce offer a wider social and economic multiplier, and it will impact firstly like the health dividend, because indeed a million of jobs needed to meet the growing healthcare demand and demographic change will be filled. Secondly, the gender equality dividend will be impacted, so because women will gain income education and autonomy, leading to improvement in education, health, and other aspects of development. And lastly, the development dividend, new job will be created and it will fuel the economy. This is briefly an introduction of women in global health.
Thank you. Hold on for a bit of time and let me introduce Patrick. So Patrick is the founder, Patrick Zaman is the founder of AVI. Am I pronouncing it right, Patrick?
Yes, you are.
Okay, and surely you look like one. From what I see, you're out of a box thinker and a serial entrepreneur. So welcome, Patrick. You could introduce yourself and tell us more on what you do. And then we actually move on to certain discussions on the topic.
Of course, yeah. First of all, thanks a lot of being here, and thanks for the introduction. So my name is Patrick. I'm the founder of AVI, and AVI is an impact venture. So that means that for us, impact is way more important than profit, and we do that in the field of the new aviation, mainly in the field of healthcare accessibility. So the reason why that is so important for me is that, well, I personally, when I look to the sky, I see a lot of opportunities that we can use the sky to improve connections worldwide. And especially in the field of pharmaceutical logistics, I think that is a very important topic. I don't think I have to explain anyone with the current situation, how huge the complexity of the operations will be regarding the COVID-19 vaccines. And again, that also influences all the other medical cargo logistics and all the projects that are running towards or in that field as well. And what we did is a couple of years ago, we started to develop autonomous flying aircraft to help deliver medical cargo, and that it can be blood, it can be personalized medicine, it can be vaccines. We do that by setting up air bridges in between the latest hubs where pharmaceutical companies can deliver to, and from that hub be able to fly to remotely located areas where usually the last part in distribution is the hardest. So the last mile's delivery is something which is not that easy, usually because the locations are so remote, but also because it's hard to maintain a so-called cold chain, so the temperature storage, especially with the new COVID-19 vaccines. That's going to be a very important topic. So we do that. We have experience and activities in a couple of different countries in Africa as well, like Rwanda, Cameroon, South Africa. And we're currently with the whole team within our company together with pharmaceutical companies and actually airline cargo operators, looking at, okay, how can we make sure that we can, for the COVID-19 situation, be able to help out by setting up these last mile logistics. The irony in this, and it's a bit weird, is that this year actually we had some projects running for vaccine delivery in Africa, or sample deliveries also for tuberculosis, for example. But due to COVID-19, these projects were halted. And this really touched me because I thought this is a really weird situation. So my personal mission in this is as well to make sure that although we are in a rush, the whole world is in a rush, we don't forget all the other healthcare and all the projects that have been building towards what we have been doing the last couple of years. And then we keep that on our mind as well.
Thank you, Patrick. Tell me, using these innovations are great, but I understand with the COVID-19 vaccine that is being developed, UK, which is under the developing countries, have announced that they're going to be releasing these vaccines. Africa and its climate and its logistic systems, the bureaucracy, and of course the government willingness. How do you see Africa as um, receiving these vaccines using the technology that your company has developed so far?
Yeah, well, I see it as a moral thing that I mean, it's all about accessibility again. Almost all of the European countries are working now day and night to be able to set up a system to have these vaccines distributed as quick as possible. But the logistical system here, especially for cold chain logistics, is in quite good condition, and therefore I think it's very important that we take the responsibility as well to offer a logistical system to anyone who needs that. Of course, it is important that there is a willingness and a demand in countries, also the countries that we work with where we have activity in Africa. It is also important that we do this complying with the regulation, both for healthcare as well as aviation, because in the end we are going through the air. It's also important that we don't forget the public acceptance, which is a very important thing, because we've noticed quite often that maybe innovations can look great because it's a new technology, you fly through the air, but in the end you are flying over a populated area, so people need to be okay with that as well. But I think we have the responsibility to at least offer the solutions that we have. And what I actually see is that luckily, that although, as mentioned, there is this big rush, many people working in the pharmaceutical industry do understand the importance of equality and equity here. So being able to make sure that everyone has the same level of access to these pharmaceutical solutions.
Thank you. Brian, back to you. How do you see Africa? And I speak from the point of view for East Africa in terms of embracing these innovations for vaccine development and then accessibility for our population, which is quite underdeveloped. And our healthcare systems are also not as developed as the other countries. In terms of cost effectiveness, Brian, how is PATH looking at cost effectiveness of bringing in these vaccines? Plus, we do have a burden of other diseases that we need to look after as Africa overall and as an East African region. I'm sorry, Brian. I think you need to unmute yourself.
Thank you. Thank you. Yes, needed that extra step. Thank you so much for that question. And often this is led by the governments themselves and the ministries of health and their overall priorities in this mix, especially with COVID impacting the economies of the countries. There is a heightened interest beyond the ministries of health as far as the decisions that are being made. I would probably say that as far as I'm seeing good inputs from the, especially from the heads of the health organizations within each of the countries, of looking at the different vaccine candidates that are coming online and what is right for their particular context and setting. So, for example, some of the candidates require ultra cold chain. What is the readiness of the country for that piece? Some of the candidates that require 1 versus 2 doses, the sort of where they are on the overall clinical trials. All those type of conversations are being considered as far as the overall cost effectiveness from that. I've been very heartened by the work of Gavi as well as the Center for Epidemic Preparedness that have been looking at this at the forefront and partnering with the countries on their planning for the implementation of the vaccines. And so they have been putting together those overall strategic plans of which populations will be received first, how they're going about doing that, how many doses they need, and this overall mix, and then putting together the overall implementation and financing plan for those. I'm actually very heartened by the work that's been going on in Africa and writ large, and well as East Africa in general. Most of the countries that I've been seeing there are probably more prepared for epidemics just because they've had to deal with things like HIV and tuberculosis and malaria outbreaks and cholera and Ebola in the recent past, or current in DRC of just being finishing that piece off. So they know how to do this, and I think that's also in the numbers itself. And so they've already been innovating on how to do things effectively at lower costs. And I feel very positive and optimistic about their ability to implement, even inside of what may be considered a fragile healthcare system, but I'm seeing non-examples by other countries. I recently came back from the United States from a hotspot there to Kenya, and I'm so excited to be ability to operate more freely, even within the number of cases that we are managing here. Over.
Good, thank you, Brian. We go to Samiratu. Can you tell us briefly on the present evidence and review analysis for diagnostic testing and women in low and middle income countries that you talked about shortly when you were introducing yourself?
I will take this opportunity to talk about women in global health and find a report which is the first comprehensive evidence review and analysis of diagnosis testing and women in low and income countries, really. So diagnostic testing has been overlooked and underfunded, despite its critical impact on health, lives, and societies, especially in low-income countries. So the historical lack of attention to and investment in testing means that for every person diagnosed with the disease, another goes undetected. Like 50% of patients get no care at all or get care too late. So our aim for this report are to present the evidence that will put testing higher up global and national health agenda, recognize and empower the women in the diagnosis delivery chain who will make it happen, and engage women political leaders and other influential women to champion testing for women, and above all, to empower women in putting their life in their own hands. So I would like to briefly highlight some key findings from the report. Like the sole study on availability in low and middle income countries found only 1% of primary healthcare facilities had access to essential diagnosis. A study in Senegal found that only 13% of women received the complete set of antenatal tests recommended in pregnancy, like during this COVID pandemic. Without a national essential diagnostic list, countries have no national standard on tests women should be entitled to receive. And countries with essential diagnostic list in development are not currently using a gender responsive approach, but there is an opportunity to change this. So the data shows that a gender blend research and development in the pharmaceutical industry, really. Medicine and diagnostic tests have often been based on clinical trials with only male subjects, resulting in some diagnoses that do not work as effectively for women. And as in October 2020, only 8 countries were reporting sex disaggregated COVID-19 testing data. Without routine collection and analysis of sex disaggregated data, key research questions remain unanswered on barrier to access for both men and women. And the gendered barriers women face to access testing are compounded for women living in humanitarian settings and those marginalized through geographical location, ethnicity, disability, and occupation. And women are 70% of the global health workforce, 90% nurses and midwives, and the majority of health workers at primary care level. Our examples from around the world show that women are doing in their community to increase access to testing. However, women are not always enabled to deliver testing. They are not paid fairly or adequately trained to or resourced. Finally, I want to say that women are at the heart of the diagnostic delivery chain in health system. So in their role as midwives, mothers, and community influencers, women have a key role in promoting testing for family and community members, as well as the delivery of the vaccine that is coming. Thank you.
That's really good. And I hope you keep on advocating for all the women there, not only women, the men as well, because we know we have maternal health, and then we have the paternal health as well, you know. But with COVID-19, how is your agency keeping on with COVID-19 testing for mothers and those maternal clinics that are there in your region?
I want to talk about the example of Burkina Faso currently. It is strange, but when you are living in this country, you seem like you are in a different galaxy. You are not in the world as over. Like here, it's kind of, people forget that the COVID-19 exists. The barrier, the essential recommendation to limit the diffusion of the virus have been left. They started early April, March to adopt a barrier from the disease, but people forgot that because the number of cases are low and deaths are low in Burkina Faso, there is no real testing. Testing is free, for example, in Burkina Faso, but it's not used. People don't really care about it because they feel like COVID-19 is a made up disease, and because they used to deal with infectious disease, malaria, it's malaria season, it's dengue season, and this is why people are reticent to adopt measures against COVID-19, because they feel like it's another disease for us, and it cannot help, it cannot keep them living their life. And if you take out the number of deaths due to malaria and dengue yearly is higher than COVID-19 currently in these countries. So there is no real strategy, even if put in place by local authority or health authority, it's not used by the population and it's not really adaptive. So briefly, this is what I can say in Burkina Faso currently from my perspective.
Okay, thank you, Samirato. I open the floor for this question with Brian, Patrick. can you give us a few ideas on how the pharmaceutical sector can innovate to solve pressing problems in the continent currently?
Maybe something that, if I may, I'd like to say about this. I think at least something that we have experienced, and not only with our innovations, but in a wider use with all the technological innovations in the healthcare industry, that first of all, the differences between the various regions, the various local cultures, the various projects are so wide that almost every time it's very good to, when you start off with such an innovation, to kind of erase your mindset and start from scratch. Then the second thing is making sure that always not only work together with locals, but make sure that local partners are actually the lead in the project. It's something that we have experienced because every time when you try to push an innovation, it's the chances are just more likely that such a project will fail. That means that in regards to the current pandemic and healthcare situation that we face, it is very interesting to see, okay, which perspective should we take on implementing such innovations? Because it is, if I hear Samiratu talk about the situation in Burkina Faso, where maybe a majority don't feel the urgency, think it's made up, or and don't see it, then if we want to push innovations for that, it will only make the gap bigger. So we should, I think, definitely rethink how we are able to work with these innovations, and that all starts first with connection and connecting on what, trying to find out what the actual problem is that people do experience, and from their work and see how we can towards maybe a aligned goal and vision.
Thank you, Patrick. Brian, anything to add on?
Well, and maybe three things. One of them, as Samiratu had mentioned, around the healthcare workers and their sort of their overall burden, and the female and gender aspects of their involvement down to the community health worker side of things, understanding their overall context and their journey to be able to understand and be able to deliver the pharmaceuticals in the right dose at the right time. So I think there's more that can be done at that level of understanding the delivery mechanisms and the logistics from that. Secondarily, I think from the national level, raising it up to the overall context of the particular country, and how does the context of this particular pharmaceutical fit into the cost effectiveness of the overall delivery of care. When I only have X number of shillings or kwacha or to be able to deliver for an individual in an overall year with the health insurance scheme, where does that particular pharmaceutical piece fit into that mix? And then the third aspect may very well be with what Patrick has been innovating on, which is sort of the equity of reaching everyone. And so the challenges of getting to somebody who's in the far reaches of Kenya or Zambia or Burkina Faso, that might, it's easy to get to the coast or the urban settings, but that when we have life-saving pharmaceuticals for somebody who needs it at the border regions, how do we get it there? And so it is the understanding the health worker context, the cost effectiveness, and the logistics of reaching everyone.
Thank you, Brian. Samiratu, do you want to add on to the question? Do you want to answer something on this question?
Yes, thank you very much, Shital. I think it's what I'm about to say is in line of with what have been said by Brian and Patrick, like to innovate and solve pressing problem like in the continent. The pharmaceutical sector could adopt basically 3 steps that have been recommended by an author called Greg Shuttle. The first step is to, these 3 steps are also in line with what women in global health ask for health security in the world. The first step is to understand the issue involved. Like for example, when we are exploring barrier to access to pharmaceutical products, for example, we need to understand the contour of the issues and what could constitute a truly novel solution. So for that, it's important to adopt a gender transformative approach to gender health security data collection, analysis, and response management in order to reduce inequity. The second step is it's important to use 100% of the talent pools and cast a wide net, if I can say. Like to define a problem and evaluate solution, it is essential to bring a wider diversity of perspective and approaches to identify new and more fruitful paths to a solution. So we must include women in global health security decision-making, structures and public discourse, including in the pharmaceutical sectors. So who else than women know, for example, their problems and the solutions? This is the same for marginalized people, disabled people. So we need to be more inclusive as we can. So the third step is to get out of the buildings and interact with and found grassroots movement to unleash capacities to address critical issues. This is to echo what Patrick said earlier. So just as interacting with specialists from other fields can take us in a new directions, seeking out new experiences ourselves can give us new perspectives and lead us in new directions. So just it's often a random insight that can finally crack a really tough problem.
I just want to pose a question to all of us here. With the current pandemic that has come to Africa, it's a global pandemic. Africa had its own issues in terms of even local manufacturing. I mean, Kenya imports in majority all its products. We're trying to kind of support the local manufacturing companies here in Kenya as much as possible. But we have a lot of issues in terms of infectious diseases. Then we had just when COVID-19 came, we had started an effective vaccine initiative for HPV, which is because schools are closed. Currently, girls at the age of 12 and 18 are not going to school right now. Schools are basically closed in Kenya and in most parts of Africa, I believe. So we have those issues. Then we have another burden of things like polio, which is ongoing right now. And to be honest, there's quite a lot of confusion. So what are your thoughts on how to kind of have strategies in place so that we can have policies eventually that the government can use, the ministries of health, and then try and use a systematic scheme to handle all these health conditions, including the recent pandemic vaccines. It's an innovation, and I believe these pharmaceutical companies are really working hard to get the vaccine on. So what do we need to do so that these vaccines, when they land on our shores, we are able to take them, yet we're able to manage other diseases as well. HIV, TB included, with the normal child vaccines as well. How do we handle maternal health with the tetanus vaccines right now? Digoxin, for labor and delivery kits. How do we manage these innovations? So I pose a question. I think we need to kind of think about it, and any one of you can try and answer. And I mean, it's a discussion.
Yeah, thanks, Sheetal. I think it's a very important topic to think about, and I actually believe that this is a global issue now as well. What we see here in Europe is that the current pandemic triggers a certain almost instinctive response that draws our attention that much that we tend to forget all the other voices, especially of minority groups, of minor, compared, of course, to the larger groups now, people that need healthcare solutions as well. And because the world is in such a rush, we tend to instinctively prioritize one over the other. I think that we need not to be smart this time, but I think we need to be wise. And this is actually something that where I believe that that we can actually use something to amplify the voices of all the people, communities, citizens, minorities that now feel unheard, with something that we actually have that has been growing the last couple of years, and that's the enormous reach that we have now of the media, whether it's the media, whether it's the social media, and all these channels. I think is something that we should use to give voice to all the others, and we need to do that because then we can equalize again where all the actual issues are, and also then we are able to make a distinction between urgency and importance. And I think that's a global responsibility that we now have, and that we should talk about.
Thank you, Patrick. Brian?
I was actually going to see if Saminatu has an extra something to add on that.
Yes, I really agree with what Patrick said. It's the current pandemic gave us an opportunity to innovate in the health sector in general and the pharmaceutical sector in particular. So it's really important to, I appreciate, I liked your comment when you said that you are supporting local industry to develop medicine locally, because we found that with lockdown, for example, in Burkina Faso, we had a lockdown in April and May. And during this period, we had a shortage in many pharmaceutical products at local level. So this shows the health authorities, and this also reveals that we really need a strategy to work around these kind of issue. It's good. It's true that we are in a global world. We cannot be sufficient, but we need to have a minimum. The country needs to have a minimum capacity to produce locally many things, important things, essential things like medicine are one of them. So, for example, and it's starting, and it's giving people the ideas and the power also to advocate. For example, for us, it's giving us the power to advocate for to support local manufacture, local initiatives, and mainly in West Africa, in Sub-Saharan Africa, these initiatives, some of these initiatives are led by women, and we really, for example, if I consider the vaccine delivery strategy, we don't know how countries like Burkina Faso will be able to get the vaccine. Will it be free for population? Who will get it first? Will it be like people who want to travel abroad that will be able to get the vaccine before getting in the flight, or are we going to give a vaccine to everyone, or are we going to prioritize healthcare workers because they are they are frontline workers? And if not, how can we manage to vaccine everyone, or to have a vaccine for everyone? But we have like expanded immunization program which give also which is in place, and now low vaccination of children, and it can be used, for example, to reach far population everywhere so that everyone can get the vaccine. But it's really a strategy that needs to be discussed around a table with everyone, and women, disabled, people from rural areas that need also the vaccine because they can be exposed to the virus. This is why in our perspective, we advocate for an inclusive health system and an inclusive approach in the health system, including the pharmaceutical sector, where the pandemic have really had a really good, big impact on women's health, especially when it's come to access to appropriate drug and contraceptives. For example, we know that we could prevent and control and save and even reduce vertical HIV vaccination, the termination of unwanted pregnancy, and option of unsafe abortion. But this pandemic have led to a shortage of these medicine, and most of the women were not really didn't have access to these medicine. It's important to work with everyone in order to develop a strategy that will be more inclusive and more what will reduce inequity in general.
What I've been most excited about as we've been sort of facing this pandemic has been the inventiveness of the individuals to be able to address it, as opposed to saying this is too hard and giving up. There's actually seemed to be more of inventiveness around how might we make this happen. This particular conference in general of putting this together remotely is sort of a case in point. Early on in the pandemic, there was a shortage of hand sanitizer, and downloading the guidelines from the World Health Organization, we were doing a Zoom session with healthcare workers of local sourcing those and creating their own hand sanitizer on the fly. And so there's this spot of how might we be able to deliver those pieces. I'm heartened by both Burkina Faso and Kenya that despite a lot of things around the travel restrictions or other aspects of COVID, that the drop of essential services has not been as impactful as in other countries where you've seen a quarter to 50% drop on that front. And so for me, there is always this tension between being able to improve the routine and then this reaction that always seems to happen. There's always sort of seems some emergency. Dr. Tabu, who's the head of the National Vaccine Implementation National Vaccine and Immunization Program here in Kenya, had been implementing a whole lot of new routine vaccinations over the last few years, and was really looking forward to 2020 and 2021 being the year of sort of really focusing on health system strengthening. Now he has COVID to deal with. And so there's this spot of what is next. There is this level of resiliency though, that I'm hopeful about. And I'm also been seeing the level of innovation at the local level and within the countries to be able to figure out these problems. And what I'm encouraged by is that it's not waiting for the global north or other countries to come up with those solutions, that they are thinking around their local context, and as Samarnatu mentioned, understanding the contour of their local issues and getting out of the buildings and understanding their healthcare workers and their healthcare setting to be able to reach that 100% of their population that is needed.
Thank you, Brian, for that. Lastly, I just want to ask Patrick and all of you, what more innovations are we looking forward to?
Well, first of all, maybe something that I want to address that I think is very interesting is that what we have experienced the last couple of years is that it's in many aspects of joint projects that we do with African operators, African companies. We're literally helping and supporting each other. When we talk about using drones for medical last mile delivery, we face a lot of problems here in Europe because of very bureaucratic systems, very conservative parties. And maybe the technology is there, but then a whole black box of problems starts. We have seen that within the many regions in Africa that we work with, it's sometimes the opposite. Within whether it's within Rwanda or Kenya or Malawi, there's such a different open culture towards innovation. Things can actually go way faster. And there's also a different approach there from locals involved in the general public living around these scenes. And that actually helps us as well. So what instead of trying to just offer potential logistical innovations or pharmaceutical innovations, I think we should also know and be aware of the fact that we can learn a lot from the joint work that we do in the African regions. So it can really benefit both sides. The innovations that we will see, for example, now is something that I think is super interesting. That's together with an organization that's quite active in Africa, where they use cellular towers that are on a rollout. Even in very remote areas, they need to be powered. To be able to power those cellular towers, electricity generator needs to be placed. Use that as well for vaccine storage. And you have you can make use of a coverage map, a network of certain nodes where there is already power because of the cellular towers that need to have a certain coverage. you can make sure that, well, you're only going to place cellular towers when there are actually people living there, of course. You can make use of the same nodes for vaccine storage or other medical cargo storage, and from there distribute. And then you're suddenly using a network, and you can innovate way faster. So I think that these type of ideas that are actually born in these regions, I think are great to build upon.
That is great to know about these cellular towers. We must chat on those. Brian, anything from your side on what you're working on, the future innovations in terms of LMIS systems, and anything more?
Really good question. So largely what we've been working on has been that interconnectivity and that interoperability on the logistics systems and the supply systems with the overall healthcare environment. And so what is the standards that are using FHIR and GS1 to be able to identify what has been delivered for that particular individual, and then how does that fit into the overall universal healthcare scheme? Thinking about non-communicable diseases and what is the longitudinal life and health of that particular patient. And so, and then giving them that access to their own precision healthcare and ability to manage their symptoms and needs. And so there is that three-pronged front of the universal healthcare schemes within the overall context of the country, the longitudinal life of the client, and the supply chain and logistics systems interacting that, and so that the supplies are there in the type that they need it at the place that they need it. And then that precision healthcare, so that they have access to their own personal healthcare record that interoperates with the clinicians that are consulting them on their needs.
I'm not particularly working on an innovation, but I think the COVID-19 pandemic is giving us an opportunity to rethink the health system in general. For example, with lockdown and over restriction we had to travel, we can, in Africa, for example, we can focus or we can invest resources in developing telemedicine. We don't need to have like a doctor everywhere. We know that we cannot do that in Burkina Faso, for example. We cannot have a doctor in every location, especially in rural areas. Why not have like someone trained and to have to be able to take care of the population with the help of a doctor in the cities, and using telemedicine, for example, to help them identify problem and find solution. This is, for example, for me, a lesson to learn from the COVID-19 and to invest in. And for the delivery on logistic of medicine, for example, we know that we can use drones, for example, to deliver medicine. It has been done in Rwanda and it works well. Why not invest? It's expensive. It's really expensive, but it's we have to look at the return in investment for the long term. So it's worth dedicating more resources to the health sector to build this kind of infrastructure or logistics system for the long term and to project the benefits in the long term. So this is what I can say briefly about innovation we look forward to see in Africa for the coming years.
Brian, anything to add?
I just want to emphasize what Saminatu had mentioned earlier around the understanding the contour of the issues, getting outside of the buildings, and bringing in 100% of the talent pool. There is innovation that is already happening. There are positive outliers that have figured out how to solve the problems if we sort of just dig into where those pockets are happening. increasing the collaboration and the conversations like we're doing here, as well as between countries, and seeing what how do we address those particular challenges, because we're not alone, even though COVID has really pushed that aspect of trying to divide us. But there are people that are addressing that. I'm seeing it addressed multiple times. And there are patterns and practices that I think will not only lift us out of this particular pandemic, but also improve how we deliver services and deliver supplies well into the future.
Brian, Patrick, tell me, you spoke about last leg delivery. Today we have those COVID-19 vaccines, but in future there might be newer vaccines that might be innovated by the pharmaceutical industry. As we see, there are 3 or 4 companies, and they all vary in the range of temperature, maintaining them at a certain temperature. So how are we going to manage these last delivery mile with all these vaccines that are already there, and then we've got one that is coming in, then we might have newer ones. So, it's kind of a mumbo jumbo thing. There's a lot of confusion, and you being the expert in drone technology, and right now Africa is known to have political instability all over. We've heard about Ethiopia, but I hope things are better. How are we going to deal with the last mile?
Yeah, that's a great question. And to be totally frank, there's not a single solution that I would love to now give one, but of course there is none, because it is quite complex. First of all, there are many vaccines and even different health or medical cargo packages that need to be delivered, whether it's about blood after, or whether it's about tissue samples to do research. There's a lot. First of all, we should see is what are the actual vaccines, what do they require, which type of cold chain do they need. Second, we need to look at what the logistics actually are about, in which area, in which conditions, which time of the year, and what the actual result is if the cold chain cannot be maintained. We also need to look at what is available, and sometimes there is more that we can actually use. Sometimes we just require a little bit of electricity that can be provided by solar panels to just have a small enough fridge that we can use to cool down. So at least we can cover the last 100 miles of the logistical setup to reach the last hubs where the vaccines can be administered. And for every vaccine, this can be different. The cell towers that I mentioned can be interesting there, but also the currently already existing ways of logistics. So in Africa, we have organizations that used to deliver or that are delivering medical goods by motorbike, and being able to use these networks and these people as well can be very helpful, because these organizations know already and they need to be educated in a way how to handle certain vaccines. And setting up air bridges can be a way that might be more reliable, because once you're in the air, not that much can happen. But of course, you need a workforce there as well. And what we try to do is find a way where we can, use the knowledge of locals already there, the availability of produce in that area, and then part by part find out what the best solution is for that actual project. And that's not easy, because a lot of things need to be done at the same time. But yeah. Again, and that would be something that I advocate for. Although there is a rush and there's a lot of ideas, sometimes it's good to take one step back and really look at it from a meta perspective, and let's all be wise here instead of being just fast.
Thank you, Patrick. Brian, you wanted to say something. I think you've written that you're looking forward for some vaccines that can live for longer outside the cold chain, enabling easier drone delivery for sure.
Yes,
All these vaccines that require cold chain, it's an added cost.
No, exactly.
So,
exactly.
Yeah.
Yeah, and that is I think one of the larger challenges is that the viability of the vaccine when it's outside the cold chain, then you're delivering saline into somebody's arm, and so the ability to have this sort of viable candidate that can reach those locations, and that sort of supports that aspect of utilizing drone delivery to the last mile and the far reaches, will be a great addition. And we're seeing a lot more and more advances of that. Meningitis A was one of them that has time outside of the cold chain, as well as a few others that are coming online. And then that also goes too on other pharmaceuticals, that heat stable uterotonics that are able to support the prevention and treatment of postpartum hemorrhage. And so that a woman doesn't have to be referred to a high-level health center that has cold chain equipment to be able to address a pregnancy challenge, but instead can be there local to her village and be able to receive that care that she needs. And so those are the things that I'm seeing coming out, and I'm looking forward to those type of innovations on the packaging side of things with regards to the new pharmaceuticals.
Thank you, Brian. Samira, too, would you want to add on to something in relation to advocacy, essential medicine list, local production in Africa?
Yes, about advocacy, I would just like to thank organizations that committed to work toward gender responsive health security in the context of COVID-19. And I would like to call on the pharmaceutical sector to commit to that as well, and to give their female staff a seat at their decision-making table. It's really important to be as inclusive as we can in order to hear all perspective and to use all the resources, the talent we have to understand the problem we are facing and how we can solve them. And in terms of the vaccine delivery, this is still at the same perspective, because it's important to think of the issue and to have everyone around the table to be able to design an effective strategy for the delivery. How are we going to prioritize people? Who are we going to vaccine first? Where? And to have a broader perspective as we can in order to succeed in this. And we have to learn from this to capitalize on that. And in order we don't need to face another problem or health issue and design new strategy. We need to build on what we learned from the COVID-19 pandemic, and to restructure our health system, our pharmaceutical system to go forward. We stop repeating our error and stop learning new things. We have to build on and to continue the way the world is responding currently to the pandemic. It needs to continue after the COVID-19. This is my last word, if I can say about that.
Thank you. Thank you, Samira, too. Thank you all. Do you want to have a closing remark as well, Patrick and Brian?
Let's say I'm just very happy that there is a way to talk about this, and although This year gave us a lot of challenges, even for this pharmacological event. I'm super happy that we still are able to find a way to connect, because the better we are connected, the quicker we can get these innovations tested, trialed, and set into place where needed. So yeah, thanks a lot for hosting this, giving us all the opportunity to connect and discuss these topics.
Thank you, Patrick. Brian?
Yes, and thank you as well. I appreciate the opportunity to still connect in these and remotely, and the work of this association to be able to continue to bring different individuals together to think through the different challenges of how we deliver logistics in Africa better and more appropriately to the different reaches. And as we go forward into 2021, I'm really looking forward to raising up the voices of those who may be at the far reaches of our healthcare system and the beneficiaries, and seeing how they might be included, similar to what Samanatu mentioned, of having the women at the table, of also being ensured that the patients and the healthcare workers are there too.
Thank you. I would like to thank the organizers for giving me a chance to actually chair this session. It's been great connecting with all of you, and we look forward for more innovations, not forgetting that these innovations affect our logistic systems as well in a particular way. So we must think on, yes, developing an innovative product, but how are we going to get it to our patients and the last mile delivery as well. So thank you all. We look forward to meeting you again and networking with you in future.